Good afternoon. My name is Cynthia and I will be presenting the need for Cityview Medical Center to establish a safe patient handling program. Reasons for the implementation. We have seen a sharp increase in back and shoulder injuries among the nursing staff. We received a citation from OSHA because of a violation of the General Duty Clause. Additional citations and fees will occur if these issues are not addressed. We received a fine of $16,550 per violation. A failure to abate will cost an additional $16,550 per day beyond the abatement date, and willful or repeated violations will cost $165,514 per violation. What is the General Duty Clause? Employers shall provide workers an environment free from harm or death from recognized hazards. They shall also comply with occupational safety and health standards promulgated under this Act. Each employee shall comply with occupational safety and health standards and all rules, regulations, and orders issued pursuant to this Act, which are applicable to his own actions and conduct. Why did OSHA cite us under the General Duty Clause? 4 workplace conditions must be present. Number 1, exposure to the hazard. Workers are exposed to danger when exposed to unsafe conditions, for instance, lifting and repositioning patients without the use of proper techniques or lifting equipment. Number 2, identifiability of the hazard. Employers must identify workplace hazards using historical accidents, industry best practices, or safety testing and take corrective measures. We let the problem go on for 12 months with no action. Number 3, probability of severe injury or death. The hazard has to have a reasonable likelihood of causing serious injury or death, thus demanding prompt action. We currently have an increase of back and shoulder strains and have not corrected the situation. Number 4, feasibility of abatement. Practical solutions must exist to eliminate or reduce the hazard, proving the employer's failure to act made the workplace unsafe. We have failed to come up with solutions and have failed to act. What measures must we take now? We need to revisit our IPP, ensure leadership and employees are involved, and complete supervisors' accident investigation reports. So we need to reevaluate and or update the current IPP. Responsibility. We need to assign a program administrator and make sure that supervisors and managers are implementing and maintaining the IPP. Compliance. All workers are responsible for complying with safe and healthful work practices. Communication. All managers and supervisors are responsible for communicating with all workers about work safety and health in a way they can understand. Hazard assessment. A competent observer will conduct periodic inspections to identify and evaluate workplace hazards. Accident exposure investigation. This is self-explanatory. Hazard correction. This shall be completed in a timely manner. Training and instruction. All workers shall receive safety and health practices training. Record keeping. We will choose a way to conduct it. Leadership, management, and the employees must be involved and invested in the safety program. Executives shall establish safety policies and allocate resources. Safety managers will develop, implement, and monitor safety programs. Supervisors will enforce safety protocols and train employees. Employees will follow safety procedures and report hazards. We will need to start or continue the implementation of supervisors' accident investigation reports, which will reveal the cause of workplace injuries and accidents and determine the most appropriate preventative actions. We need to focus on why the behaviors are occurring, utilize corrective actions, and apply preventative measures. We want to prevent similar injuries. We conducted a job safety analysis for lifting and repositioning of patients. We listed a sequence of the job task steps, we identified the safety hazards, and we came up with some control measures. Based on the job safety analysis, we recommend that we establish lift teams of at least 2 people to travel throughout the department. We should purchase additional lift equipment. The Easy Way Smart Bariatric Patient Lift is $15,197.95. We should provide training on the use of the lifts and also provide training on how to contact the lift teams to avoid lifting repositioning by other staff members. We also recommend completing a cost-benefit analysis. While the cost for instituting safe patient handling programs can be substantial, several studies have shown that the initial capital investment in such policies, programs, and equipment can be recovered in fewer than 5 years. After establishing lift teams to perform patient transfers and repositioning tasks, Tampa General Hospital in Florida reduced its patient handling injury rate by 65%. Its rate of patient handling injuries among registered nurses was reduced by 71%. The hospital also realized a 90% reduction in lost work days, an 84% reduction in modified duty days, and a 92% reduction in workers' compensation costs. The Level 1 Trauma Center's workers' compensation costs as a percentage of total payroll decreased from 1.14% in 1999 to 0.09% in 2012. We will need to gather data from the finance department to determine numbers versus cost. How much money is the hospital losing in employee absences, workers' compensation claims, and turnover of staff versus the cost of additional equipment and training? All staff members will be held accountable for their actions in regard to safety, following safety policies, and reporting hazards. However, safety training plays a huge role. It should occur during new employee orientation, whenever a new safety policy, procedure, program, or piece of equipment is introduced, whenever we are made aware of a new hazard, and refresher trainings can be done on a yearly or as needed basis. Thank you very much.